And welcome to another episode of Homefront. It's Rome, and this is an unplugged episode. So our unplugged episodes are getting crazy reviews. People love that we're going deeper and deeper with our health professionals, and today is no different, as we have with us two frontline doctors from the district health facilities of Sugarwanas and Arima. So we have Dr. Shivani Maharaj with us, and we have Dr. Joseph Ramdani. So welcome, doctors, to Homefront.
Welcome.
Thank you. Y'all in my home. We chilling. What is in your glass?
It's water.
All right, I just checking. What is in yours?
I would say
this one looking like vodka.
No.
So y'all are on the front line, right? So let's dive into this a little bit. How was it last year for you around when we had the first surge in the Shogunas district health facility?
So the interesting thing about at the health facilities, and not just mine in Shogunas, was that we knew this was coming. We saw it happen in China. We knew it was coming across. The states got cases. So it was just a matter of time, really, before we knew we were going to get it. And we went into preparation mode fairly early on. In fact, we were ready before we got the first case.
Okay.
At the district health facilities, at the hospital, the entire Trinidad and Tobago had mobilized to try to get ready. And among the things that we had to get ready were getting infrastructure, getting human resource, getting medication and consumables and supplies. So there were a lot of things that we had to do. And we knew when it was coming, we knew when it was here, and we went immediately into the parallel health system. And I think that preparation in that case is actually why we were able to be in the position we were to start off on the right leg in terms of managing in the pandemic.
So Shivani, I'm from Arima, so big up my Arima peeps. Oh, Arima in the house, I know the Arima hospital, and you were telling me before that the Arima hospital is now a COVID hospital totally?
Right. So we were quite fortunate in Trinidad and Tobago to have a new hospital in Arima that had just finished built. Before this wave, the Prime Minister had opened it, cut the ribbon, but we had to use it to help out, make it part of the parallel system. So the General Hospital in Arima, as it is, serves to admit only COVID positive patients, right? So where I am is in the district emergency, right? And we see everything that comes through emergency, and if patients are suspected COVID, then we will make a decision, or the COVID team, where they go. But yes, you're correct, the Arima General Hospital is exclusively COVID.
So somebody who has a regular illness, they would normally go, because I remember, why I brought up this too, is that I'm sure those of you at home remembered where the young lady went to the Point Fortin hospital to have a baby, and then she was turned away because it was deemed a COVID hospital.
Right.
So for the average person, if you have a normal illness that is not COVID and you go to the hospital, what is going to happen?
Well, the Arima General Hospital, as I said, is only functions to admit COVID positive patients, and they will redirect you to the district emergency.
To you?
Correct.
Right.
It's because we are equipped to see any medical emergency, whether it be a heart attack, trauma, or even suspected COVID patients.
So, okay, and now I go to the district health facility, I meet Dr. Shivani, and I have COVID symptoms. And then do you all do a COVID test at that facility one time?
Yes, we do. So our emergency department, as with Shogunas, is divided into a respiratory pathway, or what we would say a hot pathway, and then a cold pathway where we see non-suspected COVID cases. So any patient with respiratory symptoms or signs and symptoms suggestive of COVID-19 disease, they will go through our respiratory or our what we term SARI or hot pathway, and they will be assessed. And if we deem they require a COVID swab, yes, they will receive a COVID-19 test.
And then you redirect them based on their condition in terms of if you send them back home, if you send them to a different facility at that point?
Correct. So majority of those patients, they are swabbed and sent home on home quarantine. I would say, as Dr. Ramdani was mentioning before, about 10% of those acutely unwell respiratory cases might need hospitalization.
So Joseph, let me touch a bit in terms of Shogunas. What is a daily life of a COVID-19 frontline doctor of yourself? What is it like there? You get to the facility, and what happens?
So it's not a bed of roses by any means. But then again, it might be, because roses have thorns, right? So So what happens is that we get to the facility and then you have to get into these tents. And to get into the tents, you have to put on PPE, protective equipment, which is not the easiest thing in the world to put on. There's a certain protocol in terms of which you put on first, which you put on second, which you put on third, and there's the converse, because when you're taking out PPE, you want to make sure that you take it off in the reverse order. If you take it off in the wrong order, you're going to infect yourself, because particles would be on articles of your personal protective equipment. So you have to start, and in fact, there's a donning system and a doffing system where somebody watches you put on your PPE.
Donning and doffing is what? Putting on
and taking off.
Okay.
So you actually have a body. Somebody that pairs up with you and supervises you putting on, and then somebody who supervises you putting off, because if you do it in the wrong order, you'd infect yourself.
So that leads me to the question, if you weren't scared, you're dealing with, COVID-19 is here, it's new, the world is going crazy, panicking, people are dying all over, and now it reaches Trinidad and Tobago for the first time. They say, Dr. Joseph Ramdani, we need you on the front line, go out there. And you are like, wait now, I'm going out there to deal with this virus that is killing people around the world. Yeah. Were you afraid?
So the long and short of it is yes, we are very afraid. But we cannot shirk our responsibility, right? So we had to step up to the game. And exposure to infectious disease is not new to physicians, right? I remember a time where I was actually exposed to meningitis. In a pediatric case, and when I came home, I had to do isolation protocols as well. And just for the record, I like to state here, my wife burned my clothes, right? So she'll be listening to this. And not two brands, but she burned my clothes because she was just concerned about infectious disease.
That's what I'm coming to ask you. If your wife at this point in time, when she heard that you were called to deal with the COVID-19 patients, was she upset? Was she afraid? What was your family response to
So it's been more of a resignation to the fact that we have to be there. So by now she's accustomed to we have to go out, we have to do what we have to do. But the fear certainly is there. And in terms of managing an emergency department, you have to understand that you have to lead by example. Right? We can't just be scared and everybody else feeds off you as somebody who's in charge. So the responsibility is there to step up and to take precautions, show persons how it should be done, and work with them in the tents. Not just say it's safe from inside my office and you feel free to go ahead and engage. Yeah, you'll be safe, don't worry, right? So we had to kind of lead by example, and head off in there in the tent. So being scared, yes.
All right.
Yeah, we were scared.
So, and Shivani, the same thing for you.
Yeah.
Were you scared?
Tremendously scared. But as Joseph said, as seniors, you have to find a way to compose yourself and lead by example and be strong for your juniors, right? But fortunately, we know this pandemic was coming. We had drills and we had training in infection control protocols. So the government had things in place for us. Emergency physicians, we are the front line. We see everything before they go to any parallel hospital, right? So we did extensive training. They equipped us with the equipment we needed, right? And the battle was there. Even though we were anxious, we have loved ones home, and there was a lot of uncertainty about this disease at the beginning, questioning what to do, what not to do, how is it transmitted. So yeah, hell no. I have a little daughter, she's 3 years now, she was 2 last year, and every time I go home, will I take this home to my family? So we had many sleepless nights, but you have to find a way. It was a battle to be strong.
Because that's what I was wondering with you all, because if there's anyone who would be in contact with COVID-19, it would be you all, because you all are there with patients who have COVID-19.
Correct.
So I could understand that fear, and especially with the world going crazy and people dying, that you all are human as well. So even though you're a doctor, it's not that you're immune to it, but you all are fully vaccinated. Now, did you, when you become fully vaccinated, was it you breathe a sigh of relief, or did it reduce the fear of contracting the virus?
Rome, when Barbados gave us that 2,000 shots, and we were given an opportunity to get that, even getting the first vaccine, it took a huge weight off my shoulder. And being fully vaccinated, it actually reassures me so much. I'm sure you feel the same way, Joseph.
So having the first vaccine and then the second, it was a sigh of relief. I mean, we all know the vaccine is not 100% effective, but coupled with your personal protective equipment and the infection control cycles and so on, we felt a lot better about doing it.
So that leads me, Joseph, to the question of, all right, have you all seen any vaccinated patients who have contracted the virus that had to be hospitalized?
Right, so that's a good question. And actually, we have seen a couple of those who would have gotten the first dose. Not many persons would have gotten their second dose yet. In fact, we are now in the midst of the organizing second dose. But those persons, without exception, have not been ill enough to need hospital admission.
So you have seen none in Chaguanas that came with COVID-19 and you had to admit them to hospital?
No, they actually were mild symptoms. So
Mild.
it speaks to the vaccine, the efficacy of the vaccine in terms of mitigating some of the severe effects of COVID.
Shivani, you saw that in Arima too?
Yes, we have had a couple cases, not that many, who after first dose of vaccine, they contracted COVID-19, but no one required hospitalization. So it goes to Joseph's point that even if you do contract COVID, after being vaccinated, you do not get severe illness.
So that could give you all at home a bit of an assurance that you get your first shot and it will give you some sort of protection in terms of you may still contract the virus, but if you do get the virus, it is not going to be severe symptoms to the point where you need hospitalization. And this is based on what you all have seen firsthand on the front line. This is not stats that we pull out of thin air. These are two senior doctors who are seeing it themselves. So those of you at home, that's why we keep encouraging you to get vaccinated, because once you get at least that first shot, is going to help us to reduce the number of patients that we have in the healthcare facilities. And you could, if you do contract the virus, because it's not 100%, it's going to stop you from getting the virus, but it would it reduce the chances of you getting the virus?
Definitely.
So
Definitely.
it's going to reduce the chances of you contracting it. And then if you do contract it, it's also going to make sure that the symptoms are much milder than if you don't have your vaccine itself. Yeah? And then you get to quarantine at home.
Yes.
If you do have severe
quarantine at home.
Right, and you get to quarantine at home. So what trends have you all seen? Have you all seen any trends recently? Because I knew that they were saying that some younger people were contracting the virus. Have you seen that?
So the trends now, it's very different from what we observed last year in August, September, when we had our supposed first wave. Right now, we're seeing COVID-19 is affecting everyone. Right? Last year was primarily elderly patients with comorbidities. This year, no one is spared. However, there are a group of patients who are not doing too well. Patients who are obese, they present very, very unwell. That is what I have observed in Arima.
And you saw any trends in Chaguanas?
So the younger patients in particular, where we was almost unheard of in the last wave last year. And we are seeing the young patient who is obese. So again, speaking to Shivani's point, that seems to be a significant trend that we are noticing now. And hence the reason that we want to encourage persons to, as I said, vaccinate and get coverage, because a lot of these persons are not the younger person from last year. They actually a lot of them need hospital admission, oxygen support, for a prolonged period of time.
So is obesity a comorbidity? Because I hear the phrase comorbidity, and I will be honest with you, before this whole pandemic, I had no clue what a comorbidity was. And now we hear it all the time.
Yeah.
And I heard that with diabetes, I hear hypertension. Is obesity classed as a comorbidity?
So essentially, obesity is now considered, in fact, a significant risk factor. So it is a comorbidity and a risk factor for severe disease. For a number of reasons. So Dr. Monta would have been on the program before and spoken to obesity and inflammatory syndromes and so on. But not only that, the obese patient with oxygen requirements and ventilation is a challenge. So even when you get disease and you're more prone to disease, and then you have a more severe course of disease, particularly if you have any other comorbidity, but even if you have standalone obesity and you do contract COVID, the issue with disease progression is more severe and more abrupt. And also ventilation and ICU is going to become more of a challenge because of the physical ability to ventilate the lungs, and machines to put air in and out is going to be hampered by obesity and extra tissue and adipose tissue. So it is a significant factor now.
And you spoke to the ventilator and someone being in ICU. And there's just a quick question, because I heard a couple of people who I know personally who are on the ventilator, and I didn't know that they have to be fully sedated. Is that all the time you have to be fully sedated?
Yes, so when a person presents with COVID-19 and they meet criteria for intubation, and that criteria is not a simple criteria. You have to have progressive respiratory failure, oxygen levels are precipitously dropping despite maximal escalation in therapy, and then you now have to be mechanically ventilated. You have to be sedated and paralyzed. So it's not just sedated. So you sedated, they're unconscious, but you're also paralyzed. You can't move a muscle. And that is why we sedate before we paralyze.
Wow.
So essentially, once you are intubated, a machine is doing everything that is...
So the ventilator, somebody who reaches that point where they need a ventilator, that means that their symptoms are very, very severe. You have to put them on this ventilator. And it is a machine that is doing the breathing for you, so your lungs are not breathing for themselves.
So, and that's the reason why I intubate, because if you look at some of the x-rays for patients with COVID-19, it's dense infiltrates on both lung fields. And so your oxygen, the ability of your oxygen to pass through your membrane to get into your blood is severely obstructed. So you're not getting oxygen into your system. And then your ability, if you breathe in faster and faster and faster, you start to get tired, your breaths become less effective. So now we have to use a machine to do that for you. So ventilation, and it's not a simple decision to do that either. It's sedation and paralysis in an intensive care setting.
So we know that getting on that ventilator is not where we want to be at all. So we want to prevent that. Again, we're driving home the fact to get vaccinated. Now, a lot of people have messaged the show, and they were asking, and I have the list in front of me, they're asking about things, how they could reduce the severity of the symptoms while they're at home. Because you said, Shivani, that if you contract the COVID-19 virus and you don't have severe symptoms, you will sometimes send them home for the home quarantine. But now they are home, and how could they reduce those symptoms? And here are some of the medications that people are asking about. I'm putting you on the spot here. So let me know your thoughts on these. I'm going to split it between the both of you all. Now I'm seeing something here called ivermectin.
Right. Joseph know extensively about that particular drug.
Joseph?
So, you know, the Trinidadians have their sayings and so on, and everybody and their tanty have a cure for everything, right, as they say. So, but internationally, ivermectin is a drug that would have rapidly gained, you know, people have been talked about as a new kid on the block and so on. Even, you know, we heard about hydroxychloroquine, we heard about some other interventions. So,
Clorox.
So, so we have heard a number of interesting proposals and recommendations and so on. Now, in medicine, we have to be guided by the evidence. And evidence has to be guided by trials. And trials have to be based on approvals. And you can't do one trial with one medication. So for example, ivermectin, which is actually an anti-parasitic drug to treat worms and sometimes scabies and head lice and so on. I just want to put the reason why these things would have come out in the first place. There's a difference between in vivo and in vitro. And in vivo is within the body.
Right.
In vitro is in the test tube setting, in a controlled environment of a laboratory. Now you may have a medication that might work in a test tube against a certain parasite or pathogen or bacteria. But when you put that into our body with the host factors such as metabolism, such as intercurrent illness, such as the physiology of the person, an obese person, somebody who's immune compromised, diabetes, hypertension, and so on, it's not going to perform like it would perform in the out of the body setting. So some of these medications, including ivermectin, would have been brought up because there were hundreds of drug companies trying to look at what medication existed were there to help. But ivermectin, the trials so far, and multiple trials have been lumped together. When you eliminate bias and confounding variables, they haven't found any significant current evidence for ivermectin use. Now I said current because there are other medications, which I'm sure you said a person would have asked about as well, vitamins and fever grass. And
well, let me stop you right here because I know that I have a full list of different remedies that people are proposing here. And tomorrow on the show, we're going to bring back Shivani and we're going to bring back Joseph, our two senior doctors, and we're going to discuss some of these remedies that people are proposing home, and you all will advise us as to what would work, what wouldn't work, and what you all advise in terms of senior medical doctors on the front line, right here on Home Front, right? So tomorrow, you all don't want to miss that episode, so catch us tomorrow right here on the Home Front. This is Rome, and again, we want to thank the PED CARES Foundation for always supporting us. The PED CARES, right, the other pop on the PED CARES, right, pop on the PED CARES Foundation, always supporting the kids. So you all go donate on the PED CARES Foundation website, and we have our GoFundMe page set up as well, so you can send some donations there as well because we want to support the children of the nation. And we have to leave you all with this. We need you to vaccinate for us to be great. And I heard for us single people to be able to date, you have to vaccinate. I read an article this week that you get more swipes on Tinder if you're fully vaccinated. Yeah. So catch you guys tomorrow. You don't want to miss that episode. It's another episode of Homefront Unplugged. My name is Rome. See you guys. When I was saying the greeting, I say,